Good morning, everyone. This is the first lecture after the finishing of first internal assessment examination. As all of you know that we have started the dissection or the region like head, neck, face. So in that connection, we have started the lecture series of this development concerned with structures in the head, neck, face. Very soon, the result of the first internal assessment will be declared, theory as well as practical. In between, we have declared the attendance. But that attendance was, so many students have the queries about that, but the attendance was of the first term only. After that, we know there are two terms. Those students who have less attendance in the first term, they can cover up in second and third term. So at the end of year, we are going to take the average attendance of all these three terms. So those who have less attendance, not to worry, in second and third term, they have to attend 100%. Coming to the today's topic, regarding this development embryology. So title you can see here for the today's lecture is a pharyngeal arches, pharyngeal pouches, and clefts. So this topic is concerned with the development of head neck face. So first we'll see what do you mean by the pharyngeal arches. Then we'll see what do you mean by the pharyngeal pouches, and then we'll discuss about the clefts. So all the structures, how they develop, and what are the structures derived from it. Coming to the introductory part, as if you remember the previous lecture series, we have seen that general embryology, in that the secondary yolk sac get absorbed inside and forms the foregut, midgut, and hindgut. We know that there is a primary yolk sac, after that converted into secondary yolk sac, that also get absorbed within that embryo, and that forms foregut, midgut, and hindgut. By this time, head fold and tail folds appeared with lateral folding. So various foldings takes place. So head fold, tail fold, and the lateral folds in the stages of development of the embryo. Two swellings, meanwhile, they get developed. So these two swellings get prominent toward the head fold. One is developing, that one swelling is due to the developing brain, because below that the brain is very fastly developing, and that creates a swelling. Another is just below it, that is a developing heart. So that is a pericardial bulging, because below that the heart is developing again fastly. That is the second organ to develop there. Then one structure automatically formed there, that is called as stomatodeum. So what is it? It is the space between these two bulgings, initially closed by the buccopharyngeal membrane. We have seen this buccopharyngeal membrane. So this is closing, or that present within that space. So that is stomatodeum. And this buccopharyngeal membrane, later on it gets ruptured or broken down, and it communicate mouth with the rest of the part of GI tract. However, in between, some important change takes place. That is nothing but the series of mesodermal thickenings appear in the cranial most part of the foregut. So we have seen that from the secondary yolk sac, foregut, midgut, and hindgut get formed. Meanwhile, there are two bulgings over the developing embryo. One is due to the brain development toward the head fold, and below that, the second bulging is due to the underlying developing heart. And between these two developing, the space is called as stomatodeum, and this is initially closed by buccopharyngeal membrane. Later on, this buccopharyngeal membrane gets broken down, and it forms the mouth, or it communicates the oral cavity with the rest of part of GI tract. In between, this series of mesodermal thickenings appear in the cranialmost part of the foregut. So this is the today's topic, pharyngeal arches. So what is the pharyngeal arches? They are nothing but the series of mesodermal thickenings appeared in the cranialmost part of the foregut, to which we are calling as pharyngeal arches, or another name for it is the branchial arches. So one should know alternative name for it also when it comes in discussion. This is the picture diagrammatic explanation for this. You can see this is a developing embryo. As we have seen, the head fold is occurring here, tail fold is occurring here. So toward the head fold, there are two bulgings. What we have mentioned, first is the developing brain. So this bulging is due to the developing brain, and this bulging is due to the underlying developing heart. So between these two big bulgings, right, you can see this is the stomatodium. So future mouth we can say, and buccopharyngeal membrane is somewhere here, and it gets ruptured, broken down, and that communicates oral cavity with the rest of part of the GI tract, as we have seen foregut, midgut, and hindgut. So coming to the second picture here, now in this is the umbilical cord, this is the tail bud, right? So this is the bulging produced by developing brain, and this is bulging developed by developing heart. You can see here, this is the change here. Today's topic, right? The pharyngeal arches. In the floor of the foregut, right, where the pharynx is going to form. So in the floor of this, right, the foregut or pharynx, mesodermal thickenings take place, which are rod-like structures here. And these ridge-like structures, the mesodermal thickenings, we call as pharyngeal arches. Right? You can see here, there is a one ridge, another thickened ridge, third thickened ridge, like that. Here, the foregut part is here. In that floor, the pharynx is going to form, and here the mesodermal thickenings take place. Meanwhile, you can see this head fold is coming ahead. Then this is all the bulging due to the developing brain. You can say this is the bulging due to the developing heart is here, and oral cavity mouth is going to form here. And in this floor of the pharynx, this mesodermal thickening, ridge-like structures get formed, and they are the pharyngeal arches. You can see here, this is a developing upper limb bud or forelimb bud. So meanwhile, that also start developing. In the third diagram, we can appreciate very clearly the pharyngeal arches. So slowly they becomes large and large and start developing there. So these are the pharyngeal arches, right? So meanwhile, the lower limb bud, hind limb bud also get developed here. So in this picture, you can see right upper limb bud, lower limb bud also they are developing. Meanwhile, changes occurring in the floor of pharynx, right near the foregut. So mesodermal thickening, and to which we call as a pharyngeal arches. So coming to the today's topic, pharyngeal arches. In the floor of the site of future pharynx, the mesoderm get thickened in the forms of bars, thickened ridges, to which we call as bars. They run dorso-ventrally. This is the direction from dorsal to the ventral side. They get fused ventrally in the floor of pharynx. These are called as pharyngeal or branchial arches. They are initially 6 in number. Initially, they are 6 in number. So they are labeled like first, second, third, fourth, fifth, and sixth pharyngeal arches or branchial arches. Meanwhile, during the development process, this fifth arch can disappear, and finally, only the 5 pharyngeal arches remains. So first, second, third, fourth, as we know that fifth one get disappear, then sixth one remaining. So in total, initially they are 6 in number, but later on, fifth arch get disappear, and only the 5 they are remaining. So first pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth pharyngeal arch, fifth one get disappear, and this is the sixth one. Each arch has covering from inside of endoderm. So endoderm is lining from inside, and from outside there is an ectoderm. So these two germ layers, they are covering from inside and outside. So endoderm is from inside, ectoderm is from outside. In between this endoderm and ectoderm, there is a mesoderm. So all these 3 germ layers, they are there covering these pharyngeal arches. In between the 2 nearby pharyngeal arches, endoderm from inside extends outside in the form of pouches. So it extends outside like a pouch, and these are called as endodermal or pharyngeal pouches. This is the second topic of today's lecture, endodermal or these pharyngeal pouches. Right? While ectoderm, which is from outside, dips inside from outside and called as ectodermal clefts. So very simple, ectoderm is coming from outside to inside in the form of dips. They are called as ectodermal clefts. while endoderm is right extending like a pouch structure outside, to which we call as endodermal or pharyngeal pouches, and a single arch is there, right, which is lined from inside endoderm, outside ectoderm, and in between there is a mesoderm. So this is the structure of pharyngeal arches. Along with that, one should know the concept of right what is a pharyngeal pouch and what is a ectodermal cleft. Diagrammatic explanation for the last description you can see here, right? So this is a buccopharyngeal membrane. You can see here outer covering is ectoderm, blue color lining. Then the red side lining, right, red color from inside is endoderm. And in between this blue and red color, this is a mesoderm. So this is thickening structure, bar-like structure, what we call as the pharyngeal arches. This primitive pharynx derived from the foregut. So this is a future site of the development of pharynx, to which we call as primitive pharynx. And here, the pharynx is right, the foremost part, you can say, of the foregut. And we know that foregut is derived from the absorbed secondary yolk sac. Further development diagram here. So it is shown like dot line, this buccopharyngeal membrane, because it is getting broken down in the stages of development and it disappears. So it is shown in dot line structure. Then very well clearly develop these pharyngeal arches, one can see. And in this process of development, right, you can see here, right? So from inside, we know that this is endoderm. From outside, this is ectoderm, right? And these pharyngeal arches, they are named as first arch, second arch, third arch, fourth arch. Meanwhile, here it is very important written, the fifth arch disappears soon after the formation. So initially there are six arches, but later on we get only the five one. So that is first, second, third, fourth, and after that sixth one, because fifth get disappear. So from inside we have level as endodermal pouches. So you can see here this is outward pouch-like structure. So this is the first endodermal pouch. Then you can see this second endodermal pouch. You can see this is third endodermal pouch and fourth endodermal pouch. Well, from outside, these are the clefts, right? So this ectoderm dips inside and to which we call as ectodermal clefts. So this is first ectodermal cleft, this is second ectodermal cleft, this is third one, and this is the fourth one. Overall, these are the arches, these are the endodermal pouches from inside, and these are the ectodermal clefts. And this central portion, it is nothing but the mesoderm. So single pharyngeal arch, it consists from inside endoderm, outside ectoderm, and here in between there is a mesoderm. And this all occurring in the primitive pharynx, right? So near the floor of that the future pharynx, all these ridges, thickenings, they're occurring. The first arch is called as right the mandibular arch. Second arch is called as hyoid arch because all the structures concerned with the mandible, right, including the mandible, then the structures attached to it, muscles, right, and near about all structures, they get derived from the first arch. That's why it is called as the mandibular arch. The second arch is called as hyoid arch. So that is another name for the, these are alternate names for these pharyngeal arches. So first and second have an alternate name like mandibular arch and hyoid arch. Mostly the hyoid part structures get derived from the second arch. The fifth arch disappears soon after its formation, as we know that. So that only the five arches remains. Each arch gives rise to skeletal elements, means concerned with the bones, cartilage, then striated muscles. Skeletal muscles may migrate later on to other side. Initially, they develop in these pharyngeal arches. And these skeletal muscles, striated muscles, they shift to their natural position. So they get shifted from the original site of development. So they are supplied by the nerve of that arch because each arch has its own nerve. So that nerve gets shifted along with that muscle to that particular destination part. When they migrate, they took out their nerve along with them. So embryological origin can be determined from their nerve supply. So in this way, each arch going to develop into the some skeletal elements, some striated muscles there, some arteries, because each pharyngeal arch has its own artery. So an arterial arches, they get developed within the pharyngeal arches. So you can see this is one pharyngeal arch in which inside you can see this is endodermal covering, outside it's ectodermal covering. So this is inside, so this is endoderm, and this is outer side is ectoderm. So ectoderm, endoderm, and here it's mesoderm. Within the mesoderm, you can see, right, aortic arch means arterial structure is going to develop here. Cartilageous element is going to form there, and from that various the cartilaginous bones, later on ossified bones get formed, and each nerve has its own nerve. So one has to concentrate. For example, first pharyngeal arch. What is the nerve of first pharyngeal arch? What are the cartilages developed from the first pharyngeal arch? And what is the arterial structure derived from the first pharyngeal arch? So in this way, then later on concentrating on this endodermal, the pouches here, right? And ectodermal clefts here. So first concentrating on the pharyngeal arches. So these are the structures derived from single pharyngeal arch. In some lower animals, each are supplied by the two nerves, post-traumatic nerve and pre-traumatic nerve. So one should have a proper concept. What does it mean? The post-traumatic nerve and pre-traumatic nerve. So post-traumatic nerve means the nerve of the same arch. For example, the first arch has its own nerve, second arch has its own main nerve. So the nerve of that arch is called as post-traumatic nerve. And what does it mean by pre-traumatic nerve? The branch of nerve of succeeding arch. Nearby arch, it has its own nerve, to which we are calling as post-traumatic nerve. One branch comes from that post-traumatic nerve and supplies to this pharyngeal arch. So in such condition, it is called as pre-traumatic nerve. So pre-traumatic nerve means the branch of nerve of succeeding arch. Here in human being, it is only for the first arch. This is occurring in lower animal, right? But in human being, only this rule is occurring, right, for the first pharyngeal arch. Rest of the arches has one nerve. For the first arch, the post-traumatic nerve means main nerve of the first arch is a mandibular nerve. Pre-traumatic nerve in this case is one branch coming from the nerve of the second arch, which is a facial nerve. So one branch of it, that is chorda tympani. This chorda tympani is concerned with the taste sensation. The structure derived, right, the tongue from the second pharyngeal arch. So in this way, this chorda tympani also comes and it supplies, right, or it works as a pre-traumatic nerve for the first pharyngeal arch. So these two nerves occurring in human being only for this first arch. So the post-traumatic nerve for the first arch is a mandibular nerve. And the pre-traumatic nerve for the first pharyngeal arch is a chorda tympani, which is the branch of the facial nerve. It is concerned with the structure supplying to the tongue. So in this way, the difference you can see in lower animals and these human beings. Human being only for the first pharyngeal arch, we get structures like the lower animals. Otherwise, the rest of the pharyngeal arches, they have their single nerve. Diagrammatic explanation for this, you can see this is the first pharyngeal arch, this is second pharyngeal arch, and this is third one. So this green structure is a post-traumatic nerve. So that nerve is the nerve, main nerve of that particular arch, to which we call as post-traumatic nerve. While this is a pre-traumatic nerve, this is succeeding arch. So the main nerve of that second arch, right? This is post-traumatic nerve for the second arch, but one branch come from it and it supplies to this arch also. Structures derived from it, to which we call as pre-traumatic branch or pre-traumatic nerve. This occurs in human being only for the first pharyngeal arch. The rest of the arches, they have their own single nerve supplying to the various structures or muscles derived from that particular arches. So this diagram clears the concept of what do you mean by post-traumatic nerve and pre-traumatic nerve. Coming to the important elements, what are derived from these pharyngeal arches. So derivatives of the skeletal elements concerned with this, the first pharyngeal arch. So, or the various arches. So from the first arch, cartilage of the first arch is called as Meckel's cartilage. Cartilages derived via incus and malleus. These are the structures present in internal ear. So the incus and malleus is the smallest ear ossicles, right? So initially in the cartilage module, they get developed from this first arch. Anterior ligament of malleus, then spinomandibular ligament, bones derived their maxilla, mandible, zygomatic bone, palatine bone, part of the temporal bone. So these are the structures, skeletal elements derived from the first pharyngeal arch. So the cartilage of first pharyngeal arch is called as Meckel's cartilage. It gives various structures. Then cartilage derived incus malleus, then anterior ligament of the malleus, then spinomandibular ligament, and bones like the facial bones, maxilla, mandible, zygomatic, palatine, and a part of temporal bone get derived from the first pharyngeal arch. This also called as, we know that, mandibular arch. So the various structures concerning the mandible, they get derived here from the first pharyngeal arch. Cartilages derived from the second arch. They are nothing but the stapes. In stylar process, stylohyoid ligament, smaller cornu or the lesser cornu of hyoid bone, superior part of the body of the hyoid bone. These all are the structures derived from the second pharyngeal arch. Cartilages derived from the second pharyngeal arch. Exam point of view, most of the times you may see question on this area like derivatives of first pharyngeal arch or derivatives of second pharyngeal arch. So in that case, you have to write with the help of diagram what are the structures derived from the first or second these pharyngeal arches, or later on third, fourth, and sixth arches. Coming to the cartilages derived from the third arch, they are nothing but the greater cornu or the large cornu of the hyoid bone. Then lower part of the body of hyoid bone. So we can see here, mostly the hyoid bone get developed from the second and third pharyngeal arch. So smaller cornu from the second pharyngeal arch and greater cornu from the third pharyngeal arch. Then upper part and lower part of the body of hyoid bone from the second and third pharyngeal arch. Cartilages of fourth and sixth, because fifth get disappear. So cartilages of the fourth and sixth arch, they are nothing but the various laryngeal cartilages. You can see here diagrammatic explanation. These red color structures, they show cartilages derived from the first arch. You can see here green structures, they are nothing but the cartilages of the second pharyngeal arch. And you can see here the third arch cartilages, they are shown in this orange color. You can see here these are the cartilages derived from the fourth and sixth arch. Why should make the practice to draw this diagram, so which will explain you the structures derived. The cartilage is basically derived from the various pharyngeal arches. On other side, you can see this is the incus, this is the malleus, so which is derived right from the cartilage derived from the first pharyngeal arch. You can see here this is a spinomandibular ligament. Then the various remnants of the Meckel's cartilages within the mandible. So that Meckel's cartilages concern with the development of mandible bone. So these are the structures derived from the first pharyngeal arch. Then cartilages from the second pharyngeal arch, you can see stylar process, and you can see this is a stylohyoid ligament between stylar process and hyoid bone. So stylohyoid ligament. Then you can see here, right? So the lesser cornu here, right, and upper part of the body of the sphenoid, this hyoid bone, right? Then this third arch, right? So you can see here the greater cornu, right? You can see here this is the lower part of the body of the hyoid bone. Then fourth and sixth, they are developing laryngeal cartilages, for example, thyroid cartilage, cricoid cartilage, right? So they are derived from the fourth and sixth pharyngeal arches cartilages. So this diagram explains all the derivatives, right? Cartilaginous derivatives of the first to the sixth pharyngeal arches. So what are the nerves and muscles of these various pharyngeal arches? So the first arch, the nerve of first arch is the mandibular nerve. That's why that first arch is also called as mandibular arch. So the nerve of the first arch is mandibular nerve. Muscles derived, they are medial and lateral pterygoid. So they are called as muscles of mastications. So medial and lateral pterygoids, then masseter muscle, then temporalis muscle, mylohyoid muscle, anterior belly of digastric, then tensor tympani, and tensor palati. These are the muscles concerned with the soft palate. Then anterior belly of digastric. This digastric muscle is very interesting in this head neck phase. Di means two, right? Gastric means having a shape like a stomach. So it has two bellies, anterior belly and the posterior belly. So anterior belly has a different nerve supply and posterior belly has a different nerve supply. And the reason is in this embryological origin. Anterior belly of digastric developed from the first pharyngeal arch, and we know that first pharyngeal arch nerve is mandibular nerve. So this anterior belly of digastric is supplied by one branch that coming from the mandibular nerve. While the posterior belly, you can see here, it is derived from the second pharyngeal arch, and the nerve of second pharyngeal arch is facial nerve. So this posterior belly of digastric is supplied one branch from the facial nerve. So the one muscle, but it has two different nerves. Anterior belly by the mandibular nerve branch, while the posterior belly of digastric supplied by the one branch from the facial nerve. So one should remember that why this anterior posterior belly has a different nerve supply, though muscle is same. So that reason or is in this development, right? So coming to the second arch, the nerve of second arch is facial nerve. Muscles, they are the muscles of the face. So the facial muscles. Then occipiter frontalis, as we have seen, this is in the scalp. Then platysma, styloid muscle, posterior belly of digastric, stapedius, and auricular muscles, muscles of the ear. So all this they are derived from the second pharyngeal arch. As these muscles are derived from second pharyngeal arch, naturally they are supplied by branches from the facial nerve. Third arch, the nerve of third arch is glossopharyngeal. The muscles derived are stylopharyngeus. That's why the stylopharyngeus has a nerve supply from the branch from the glossopharyngeal nerve. The nerve of the fourth arch is a superior laryngeal nerve. And muscles, they are muscles of the larynx and pharynx. So these muscles of larynx and pharynx, they are supplied by superior laryngeal, right? Because it is the nerve of the fourth arch. When the nerve of the sixth arch, fifth arch will disappear. So sixth arch nerve is recurrent laryngeal nerve. And the muscles, again, they are concerned with the larynx. So few muscles of the larynx, they are supplied by this recurrent laryngeal. Some of it, they are supplied by superior laryngeal. Now, so in this way, fourth arch nerve is superior laryngeal. Nerve of the sixth arch is a recurrent laryngeal nerve. So this slide explains you what are the nerves and muscles derived from the first arch, second arch, third arch, fourth arch, and sixth arch. So one should remember what is the nerve of each arch and what are the muscles, right, derived from these various arches. Cartesian structures we have seen in the last slide. Then coming to the another important topic, right, ectodermal cleft. So what is a fate? Means what are the structures in future going to develop from this ectodermal cleft? Once the pharyngeal arch is formed, outer side marked by the series of grooves or ectodermal cleft, dorsal part of the first cleft is going to develop into the epithelial lining of the external acoustic meatus. So this is the structure derived from the dorsal. It has ventral and dorsal part of this first ectodermal cleft. Pinna get formed from the series of swellings. The swellings are also called as hillocks that arises on first and second arches. Second arch grows faster in downward direction. Due to this downward growing fast direction, the structure, so the beaded appearance of third, fourth, and sixth arch, it get convert into the smooth structure. That's the neck becomes smooth. So one should understand at this level what do we mean by cervical sinus. The gap between this process, the second arch, which is growing faster in downward direction. So there is a gap between this process and third, fourth, and sixth arch. This gap is called as cervical sinus. Due to this overhanging process, means this second arch growing fastly downward direction. Due to that overhanging process, neck becomes smooth because in adult we cannot see the beaded appearance in neck. Neck is very smooth because initially in early stage it is beaded because thickened ridges of the second, third, and fourth and sixth arches are there. But second arch from lateral side it grows downwards and that makes the neck smooth. But the gap remains between this downward process and this the third, fourth, and sixth arch, and this gap is called as cervical sinus. Diagram for it you can see here. This is the first arch, second arch, third, fourth, and sixth. So from second arch, there is a downward growth, projecting, growing downwards from the second arch here. And it extend downward. You can see here. So it extend downward. So this beaded appearance of this arch, this arch, this arch, it becomes plain smooth from the outer side. That's why later on neck becomes smooth. But gap remains between these arches and this downward growing process. And this is called as cervical sinus. It has very clinical importance. So what is clinical importance of this? One is called as branchial cyst. Usually, this cavity of cervical sinus get obliterated, means close, but sometimes it may persist and gives swellings on anterior border of sternocleidomastoid muscle that is called as branchial cyst. So, if that gap is not closed, normally it get obliterated, close, but if it is remain pattern, right? So that time, due to the collection of the fluid, so from anterior border of the sternocleidomastoid muscle, which is the key muscle in the neck region in this, so you get swelling on the anterior border, and this is nothing but the collection of the fluid in this space, and this is called as branchial cyst. When it such cyst opens on surface, that is called as branchial sinus. So branchial cyst means collection of the fluid, cyst like swelling from the anterior margin of the sternocleidomastoid muscle, right, projecting forward. So it is coming from the cervical sinus, that is called as bronchial cyst. And when it opens outside, so it has communication on both ways. So it is called as branchial sinus. If such cyst ruptured and opens on the surface, that is called as branchial sinus. So branchial cyst and branchial sinus is a clinical aspect of this cervical sinus. So in this way, this gap, what we call a cervical sinus, sometimes fluid may get collected here, and that is a you can say the branchial cyst. Later on, communication on both sides, right? So that sinus opening, so branchial sinus is there. Coming to the fate of endodermal pouches. So we have seen ectodermal clefts. Then coming to the endodermal pouches. So the first pouch, ventral part, is involved in the formation of tongue. So tongue, which is a concern, which the organ present in oral cavity or mouth, concerned mostly with the taste. So ventral part of this first pouch is involved in the formation of tongue. Dorsal part combines with dorsal part of the second pouch and forms tubotympanic recess. So structure concerned with the ear. Proximal part forms auditory tube and distal part forms middle ear. So in this way, the first pouch, ventral part is involved in development of tongue, while dorsal part is involved in the forming, right, of the middle ear structure and tubotympanic recess and auditory tube. While the secondary pouch or the second pouch, ventral part is involved in formation of tonsils, which is a lymphatic structure, and dorsal part contribute to form again, right? We have seen here, right, tubotympanic recess. So half part is formed by the first pouch and half part is derived from the second pouch. So here it is also dorsal part contributes to form tubotympanic recess. Third endodermal pouch is involved to form one of the parathyroid gland, which is called as inferior. And another lymphatic structure is a thymus. Development of thymus and all that we'll see in next lectures. While the third pouch, right, involving this inferior parathyroid gland and thymus structure development, fourth pouch is involved in the formation of superior parathyroid gland. So another parathyroid gland, there are two pairs, upper and lower, or superior and inferior pairs of parathyroid gland. They are around the thyroid, so called as parathyroid, on the posterior aspect of the thyroid gland. And also the main thyroid gland, right? So it is derived from the fourth pouch. So fourth endodermal pouch is involved in formation of these two structures, superior parathyroid gland and thyroid gland, the lateral part of it. So it is called as lateral thyroid. The fifth pouch, also called as the ultimobronchial body. Right? So its development, right, is a controversial factor. So some authors say that, right, the parafollicular cells of the thyroid, they are derived from this ultimobronchial body or the fifth endodermal pouch. So it is a questionable, right? But most of the authors prefer that it is involved, this ultimobronchial body or the fifth pouch is involved in the formation of parafollicular cells, right, which are present in thyroid gland. This is a diagrammatic explanation for this last explanation. So this is the first endodermal pouch, this is the second endodermal pouch, this is the third one, and this is the fourth one here. So the first we have seen that the ventral aspect will develop involved in the development of tongue, then the dorsal aspect is along with the second endodermal cleft, right, is formed the tubotympanic recess. Along with that, middle ear is formed, then auditory tube, right, and is also formed. From the, you can see here, right, the tonsil. Tonsil is also going to get formed here, right, from the ventral aspect of the second endodermal pouch here. From the third endodermal pouch, the parathyroid gland, right, the inferior parathyroid gland is going to form here. Then here, right, from the fourth one, you can see the superior parathyroid gland is going to develop here, and here the lateral thyroid. Right? While this third one is also involved in formation of thymus gland. So in this way, first endodermal pouch, this is the second endodermal pouch, and the third one, okay, and this is the fourth one. Meanwhile, these two structures, right, this is a thymus, right, which is going to get formed from the third endodermal pouch. It migrates downward because its location is in the thymus region. So it comes downward, right? Along with that, this thyroid also, parathyroid also comes down. That's why it is called as inferior parathyroid, right? Why this, right? It remains as it is position, right? This parathyroid gland derived from this fourth endodermal pouch, it remains as it is, but later on it becomes superior as it comes down. So this becomes superior. So this is called a superior parathyroid gland, and this is called an inferior parathyroid gland. But initially they are reverse in reverse location. So though we are calling it inferior, but it is at superior level initially. But later on, due to the migration of this thymus, right, it comes downward and located in thorax. So this comes downward little bit here, and it remains as it is here. So this is superior parathyroid, and this is inferior parathyroid gland, right? And this is the lateral thyroid, what we say, right, from the fourth endodermal pouch. So the this dorsal aspect is involved in formation of the thyroid, which is called as lateral thyroid, because main thyroid gland is derived from thyroglossal duct. So only the lateral aspect of that, right, is derived from this. That's why it is called as lateral thyroid from this fourth endodermal pouch. So in this way, this diagram one should able to draw and make the practice to draw this diagram. So this will explain you, right? So the endodermal pouches derivatives. If there is a short note on endodermal pouches, one should able to draw this diagram and explain all the structures derived from the various pouches. So this development of thymus, right, we will see in the next lectures. So till now, what we have seen, right? We have seen the what do you mean by the pharyngeal arches? They are nothing but the thickenings, right, on the floor of the pharynx in the lateral ventrodorsally, right? So in the floor of the pharynx, and this thickening, right, mesodermal thickening or ridges, we call pharyngeal arches. So we have seen the structure of the pharyngeal arches. Then we have seen the what structures in the form of cartilages, bones, muscles that derive from the various arches. Then what are the nerves of this first, second, third, fourth, and sixth pharyngeal arch? Then we have seen what doing by post-traumatic nerve, what doing by the pre-traumatic nerve. And in human being, this occurs only for the first pharyngeal arch. That is the nerve, first pharyngeal arch is mandibular nerve, and this the pre-traumatic, right, nerve is a cauda tympani nerve, which is a branch of the facial nerve. And facial nerve is a post-traumatic nerve for the second pharyngeal arch. Afterward, we have seen the ectodermal cleft. And what are the structures derived from the ectodermal cleft? And in the third topic, right, we have seen endodermal pouches. What do you mean by the endodermal pouch? And what are the various structures concerned or derived from these various endodermal pouches? I hope you understood this today's lecture concern about this pharyngeal arches, pouches, and clefts. In the further lecture series, right, we'll see the further structures derived, right, concerned with the E.lect phase. So here we conclude this today's topic. Thank you.